So, what if I told you that your child's temper tantrums and their focus issues might actually be starting in their stomach? And what if the key to improving their mood and behavior isn't actually all in their head, but in their gut? So, today we're diving deep into the gut and brain axis and why your child's digestive health might actually be the missing piece to your child's mental health puzzle. Hi, my name is Danielle Orr, and I am a family nurse practitioner, a psychiatric mental health nurse practitioner, a functional psychiatry coach, and a mom of two kiddos. And I'm here to share some science with you guys. I have found out that parents don't really know a whole lot about their kids' brain and gut connection. And so I wanted to share more about that because I see this in my everyday practice that I feel like I'm explaining it a lot. And so I'm sure that there's a lot of parents out there that just really don't know what's going on. So there's some fascinating science about what's going on with their kids' guts. And so researchers are actually calling your child's second brain their gut. So they're saying that your child has two brains, right? So their brain and their brain. And so I want to talk about this a little bit more. It's going to be about the gut and the brain connection. If you're a parent who wants to understand better the real science behind the why gut health actually can affect your child's behavior, grab a pen and a paper, and by the end of this video, you will understand exactly what's going on with your child's gut and how it's communicating to their brain when they're having these meltdowns and having behavioral symptoms and what you can do to support both of them. Let's start with some mind-blowing facts about your child's gut. Fact number one, your child's gut contains over 500 million neurons. That is more than their spinal cord. And this network of connection is called the enteric nervous system. And it's so complex that scientists are literally calling it the second brain. Fact number two, that 90% of our serotonin is made in our gut. And if you've heard any videos on me talking about serotonin, I talk about this a lot. So it's our neurotransmitter that is responsible for mood or sleep or emotional regulation, and it's processed in our and produced in our gut and not in our brain. And so it comes from our gut. And so think about that for a moment. When a child is anxious or depressed or struggling with sleep, we immediately think that their brain is the problem, but really it might be a gut problem. So fact number three, your gut of a child produces more neurotransmitters than their brain does. And we're talking about dopamine and GABA and norepinephrine. And these are all of our chemicals that help really control our focus and mood and behaviors in our kiddos. And fact number four, the gut and the brain communicate through multiple pathways. And the different pathways that they communicate through are the vagus nerve, the immune system, through hormones and metabolites that are produced in our gut. And so this communication is really, really important. It's bidirectional, which means that if there is stress that's affecting our gut, then it's affecting our brain because the gut is affecting the brain. Here's why it's really interesting with our kiddos. Children with ADHD, anxiety, or autism, or even other neurodevelopmental differences, research is consistently showing that these children have a difference in their gut microbiome compared to neurotypical kids. In 2019, there was a study that was published in Microbiome that found that children with autism had significantly different gut bacteria patterns than those that didn't have autism. And the severity of their symptoms behaviorally correlated with the severity of their gut issues. There have also been similar patterns that have been found in ADHD research. But here's what's crucial to understand. It's not a correlation. We have found evidence that gut bacteria is actually what's influencing our brain development and function. And this is what we're calling the microbiota gut brain axis. And so it's really important to remember these things because the gut microbiome and the brain and the gut axis, there's also the microbiome gut axis. And so whatever bacteria is going on in our stomach is how is it getting up to our brain and how is it being used correctly. Let me explain to you how bacteria in your child's gut can actually be influencing their behavior and their mood. The neurotransmitter production is important because there are different bacterial strains that are produced in our gut that are producing different neurotransmitters. And those can be things like producing our GABA or our serotonin or our norepinephrine or our stress hormones. And if we don't have those producing correctly, we're going to have behavior issues. When your child's gut microbiome is imbalanced, we call this diagnoses. And I'm sure you've heard about that before. And this just means that they're not producing adequate amounts of the mood regulating hormones, or maybe they're producing too many or too little. And so this is why it's really important. So then we have the vagus nerve highway. So the vagus nerve, again, if you heard me talk about this, that's the one that runs from your nose to your butt. And it really does so many things. So we call it the superhighway because it connects your brain to your gut with our kiddos, with anybody. And so gut bacteria can stimulate the vagus nerve, sending these signals directly to their brain. And it's controlling our kids' mood and their anxiety and their stress response. And so if we're sending improper signals, we can have all these things misfiring. And so studies have actually shown that communication can be disrupted. And when that happens, kids are experiencing increase of anxiety, depression, and behavioral issues. So conversely, when we support good bacteria in our gut and healthy bacteria, the vagal tone in the vagus nerve actually improves, and so does our emotional regulation. This is why it's really important to really keep that together and figure it out. Inflammation control, this is a huge thing. So an unhealthy gut microbiome can actually produce inflammation and cause more inflammatory compounds in the child, or LPS, basically leaky gut. So where that is the issue is that these inflammatory molecules enter our bloodstream, travel to the brain, causing neuroinflammation. So if your tummy is inflamed, your gut's inflamed, your brain is going to be inflamed. And neuroinflammation can affect things like attention and focus and emotional regulation and sleep patterns and sensory processing and social behavior. And again, gut inflamed, brain inflamed. So I see this constantly in my practice. Children with chronic gut inflammation often struggle with brain fog, emotional volatility, and sensory issues. Another thing to think about is metabolite production. Healthy gut bacteria actually make your short chain fatty acids, which are really important because it helps reduce our brain inflammation and it supports the blood-brain barrier, and it helps your BDNF make sure that we're having that growth of it, and that's really what we need to keep our brain growing and developing. It also can improve our cognitive function. So children with gut dysbiosis actually often have low levels of these protective metabolites. We need to fix those things. Let me share a case study with you guys. I once worked with an 8-year-old boy who was diagnosed with ADHD and anxiety. And he had been on a stimulant for a very long time, couple of years. And mother had mentioned that he had constipation issues in my office and frequent tummy aches. And people always find that interesting when I ask this question because they're like, you deal with mental health. Why are you asking about my kids' poop? It's important. It's important to me because I need to know what's going on with their tummy, right? And so we actually tested his gut microbiome and we found severe dysbiosis, very low levels of that beneficial bacteria and overgrowth of the inflammatory species in his gut, which means that his levels were elevated in certain ways, which meant that he had leaky gut. And really, the short chain fatty acid, the good things that we needed in there, just were like non-existent. And so we were able to focus in on targeting and healing his gut with prebiotics, probiotics, and gut health nutrients. And within a few months, his behavior had drastically improved. His teacher noted that he was doing much better. His emotional regulation was better. And mom said that he was sleeping through the night well and wasn't having super restful sleep, which is amazing. And that's what we want for our kiddos. So these are some things that can damage that gut and brain connection. Now, before everybody comes at me, I'm not saying that what I'm about to mention is wrong in how you raise your child by any means. But these are things that can disrupt our gut bacteria and ways that we need to think about and just be aware of that if these are happening and we need to do them, then that's okay. We just need to figure out how to support our kiddos. Again, I'm just giving you that preface on this one. We need to really understand what is damaging our gut and brain connection because it's crucial in prevention and healing. A couple of the major culprits that I see are antibiotics. That is a big one. Antibiotics save lives. Don't get me wrong. They are needed for certain things and absolutely we should be using them. But they can also wipe out the good bacteria in our gut that's beneficial. And so research is actually showing that children who have early use of antibiotics, it can increase the risk of ADHD and anxiety and potentially autism spectrum disorders and different things along those lines. So a single course of antibiotics can actually reduce the gut diversity for a couple of months or even up to a year. Kids that have chronic ear infections or strep infections or other common illnesses, it can permanently disrupt their gut microbiome. But again, I'm not saying don't use antibiotics. My children have been on their own antibiotics throughout their time. And it's one of those things where if we know this is potentially what's going on, we just need to figure out how to support it because, again, antibiotics do save lives. So I just want to make sure that everybody understands that that's very clear. Something else that's very important to understand is that the standard American diet, it's called the SAD diet, is called that for a reason. So processed food, sugar, artificial dyes, artificial additives, all of these things are harming the good bacteria in our gut and they're starving the good bacteria. And so things like food dyes and preservatives and emulsifiers can actually directly damage the gut lining in our kiddos and promote inflammation. And again, inflamed tummy, inflamed brain. So I see a lot of times a lot of my kiddos, chicken nuggets, mac and cheese, goldfish crackers, fruit snacks, fruit rolls, those kind of things are all highly processed foods. They can actually promote the gut dysbiosis, which means that they're just feeding into that dysregulation in their tummy. Something else that's really important to think about is chronic stress with our kiddos. A lot of people don't really think that kids have stress. What do they have stress to be about? Or why are you stressed? There's no reason to be stressed. But there's a lot of school pressure and family conflict or sensory overload. It can actually damage the gut bacteria directly, and it can cause issues in the intestinal permeability. And that's how how things are moving along in our gut and how like absorbent our gut is. And so children with gut issues, they usually have more high anxiety, and it's just creating this vicious cycle that we have to get out of with them. Something else to be very aware of is environmental toxins. So our pesticides, our heavy metals, just different things like that can actually be harmful to our gut. And so if you are able to, and it's financially feasible, trying to buy, that you've seen the dirty dozen, trying to keep away from those, buying organic, really making sure that if you're getting fruits and vegetables that we're cleaning them and making sure that they're clean before we eat them, because we want to get those pesticides off of our fruit before we put it into our body. Another one that's big is our antacids or acid blocking medications, so our PPIs, things that can actually change the gut pH and the microbiome. And what it's doing is it affects our neurotransmitters and also our nutrient absorption. Another one, and some people might get mad at me on this and kind of controversial, but C-section deliveries, formula feeding, and early antibiotic exposure can introduce issues in the initial development of gut microbiome. So there's something that when a child is born vaginally, they actually are getting the bacterial seeding from a vaginal birth, which is different, and they need that in the beginning. However, that being said, I myself have had both of my children were C-section, and both of my children were both breastfed and formula fed from the very beginning. I'm not here to bash anybody on that. I am supportive in getting that baby out, getting a healthy baby, having mama be healthy. And do not feel bad if you had a C-section. That is okay. People needed to get the baby out, and that is okay. And so I want you to know that we work with it, right? Again, both of my children were C-section and both of my kids were formula fed from the very beginning, because that's just what we needed to do. And that's okay. And you can't have that mom guilt over it and wonder, does my kid have anxiety now that I gave them formula when they were a baby? No. So I want you to be very assured in that it's okay, and we have to do what we have to do to have a healthy baby, because a fed baby is a happy baby, is a healthy baby. And that's how we look at it. And we can just continue to work through their tummy issues as they get older. And that's okay. So you might be asking how we actually test this. And this is something that we do in functional medicine. And we have different ways that we can test what's kind of going on with our kiddos. So we can do a stool study, or we can look at the gut permeability, or OAT testing, which is organic acid testing, food sensitivity testing, inflammatory markers, and really just looking at what is going on with our child and how we can actually heal their gut. And here's what's really important to understand. So your child's regular pediatrician probably won't be ordering these tests. Standard medical care focuses on treating the symptoms and not investigating what the root cause is. But when we look at it from a functional side, these results are giving us a roadmap for healing, so then we can take out the guesswork and figure out what's going on, or try to guess at what's going on, and really see what's wrong with our child, and give us a good roadmap of like, hey, this is how we can fix our kids' gut health and see exactly what needs to be addressed, and give them that very personalized care, which I think is amazing. Here's the beautiful thing about the gut and brain dysfunction. It's highly treatable. And here's how we look at it. There's the 5 R's that we look at. So we have different phases. So first we remove, and then we replace, and then we re-inoculate that good bacteria in our gut. And then from there, we do some repair and just really work on getting good gut healthy, or healthy gut lining and things along those lines. And then we rebalance, and we look at all the things that can really just potentially be causing stress, and try to avoid them for the future for our kiddos. Because once we've gone through all this work, we want to go backwards. So it's really important that we just look at all these pieces, and we use those 5 different phases to work on. And those are things that I do in my program, where I work with kiddos and I work with their parents and go, okay, let's break it down. We have this roadmap. This is what we're going to do to just help all these things with our kiddos. So it's really important that we remember, when we're talking about the gut and bacteria, there's things that can be called SIBO. And so I don't know if you've heard of SIBO. So it's a small intestinal bacteria overgrowth. That's one of the things that I test for. I've had kiddos that have come back with that, and a lot of food sensitivities and just really low levels of beneficial bacteria. And because of that, it's caused leaky gut. When we're really just getting on a good antimicrobial probiotic to address the SIBO, or the small intestinal bacterial overgrowth, we are really able to focus on what's going on and help alleviate, if not completely make our symptoms go away, as far as attention, focus, and mood. And so it's very common where I hear parents go, oh my gosh, like my kid has completely changed, and they're sleeping better, and they're not complaining of the tummy aches, and we're not having the big disruption of going to school in the morning, or the big meltdowns. And it's just amazing how the gut is so connected to your brain. Let me briefly explain how gut health can be affecting and showing symptoms of certain things that we diagnose in our very common things that we diagnose in our kiddos. So ADHD, a lot of times there is increased intestinal permeability, which means that there is altered gut bacteria and chronic inflammation in our kids' guts, which is showing that certain bacterial strains can actually improve our attention and focus and reduce our hyperactivity. So if we know what they're deficient in, we can come in there and fix that, and hopefully cause less of their ADHD-like symptoms. Anxiety. And again, you've heard me talk about this a million times. So gut dysbiosis directly affects your serotonin and your GABA, and serotonin is made in your stomach, right? We talk about this all the time, guys. And so many of our kiddos that are anxious have a lot of gut and digestive issues, constipation or chronic diarrhea. lots of tummy aches, those kind of things. Sometimes it's reflux. It can show up in different ways. And so once we get that gut lining back in order, they actually feel much better and less anxious. Autism. I'm not saying that a leaky gut is causing autism. That is not what I'm saying. But what I'm saying is that research is showing that an altered gut microbiome is very common in our kids with autism. And so many of these kiddos are really just having issues with they're now calling it the gut autism axis, which means that in the scientific literature, we're showing that gut healing is actually helping decrease some of our behaviors with autism. Again, fixing the gut, healing the gut does not make autism go away. But if we can help support them and have them be maybe less anxious or less sensory overloaded, that would be phenomenal. Another thing that we have some studies and information on is the sensory processing issues. Gut inflammation can actually increase your overall nervous system sensitivity, which means you can be hypersensitive to certain things. And so if we can get that more balanced, we're going to see less reactivity in our kiddos, which would be awesome too. And then lastly, sleep issues. Again, 90% of our serotonin is made in our gut. Gut dysfunction leads to sleep problems. And when we're having sleep issues, a lot of time when there's gut dysfunction, we're not able to produce the melatonin that we need to sleep well. And so this can all be affected by gut health. So these are just some small examples of how gut health is actually affecting our brain. If you're watching this and you're recognizing some of these symptoms in your child, I want you to know that the gut and brain dysfunction is very common and it's very treatable. And you don't have to accept that your child will always struggle from these issues. I want to help you. I want your child to feel well. You're my kind of people that I want to help and I want to see your child be successful. And in my functional psychiatry coaching practice, I address gut health and I get to the foundation of what is going on and everything else that's included with it. So we heal the gut, we can see improvements in behavior and focus and sleep, and really go beyond all of that and help support the family, have your child thrive. And when your child's thriving, you as a parent are thriving. And so if you feel like you want to dig deeper into that gut and brain dysfunction with your child, I offer free discovery calls to see if we're a right fit, see if it's something that would work well. And I would love to speak with you. Please reach out because you're my people and I really would love to help and I love to spread the knowledge. And I've seen so many positive changes with fixing our gut. In closing, remember your child's behavior, their mood, their focus may not all be in their head. And they might be having issues that are starting in their gut. And the gut brain connection is real and it's powerful. And when we support it properly, we are seeing remarkable transformations. And I love that. And this is what I do, why I do what I do. So your child's second brain, their gut, might actually hold the key to unlocking their potential, which is awesome. So when we fix the gut and heal the gut, we are helping heal their brain too, which is amazing. So if you found this video helpful, please give it a thumbs up and subscribe for more content about functional approaches to children's mental health. And if you know a parent who's struggling, feel free to share this video with them so they can also get educated on the gut and brain connection for their child. So thank you for watching. And remember, there are answers to your child's struggles. Sometimes we just need to look in unexpected places. So I'll see you guys in the next video. Have a great day.